Well, if everybody's ready, we'll go ahead and begin. I am Jen Roberts and we're at WakeMed, so we're really excited to dive in and get started. So, things would to be able to be a Jedi. Well, with a cool lightsaber and the power to heal people. Well, guys, believe it or not, we actually have our very own Jedi Masters that work here at WakeMed. And as our pharmacist, their knowledge, but it also helps them to recover in a quicker amount of time. So I would like to introduce to you one of our Jedi Masters, Miss The Force Be With Us.
Hey everyone, I'm Erin Coots. Hope y'all are doing okay. It's a little odd to present this way, but I am the pharmacy operations manager for WakeMed Health and Hospitals here in Raleigh. And I'm here today just to tell you a little bit about pharmacy in general, but especially hospital pharmacy. If you look at this first slide, this kind of makes me laugh because I think a lot of folks may not understand exactly what hospital pharmacy is. And so I hope that I can help you all understand that so you can consider it as a career choice. And so I'll go through a few slides and then you can ask questions, but um, we will get started just with some education requirements. So here in the US, it's changed a little bit over the years, but now to be a pharmacist, everyone has to have the Doctor of Pharmacy or the PharmD degree. So before you enter that program, of course, essential coursework is required like biology, chemistry, physics, everything like that. And there's a couple of different paths. So a colleague of mine just did the 2 years of pre-pharmacy school, which is, in your undergrad, you do the pre-pharmacy curriculum. And then she was able to start pharmacy school as a junior. And then it's 4 years since 4 years of pharmacy school starting then, but then she received her license from the Board of Pharmacy. I took a slightly different path. I went ahead and finished my undergraduate degree. And then, since I wasn't sure what I wanted to do, I took some time off and then started back with the PharmD program and did another full 4 years before I sat for my Board of Pharmacy exam. So, after that, too, now there's a lot of opportunities for postgraduate training for pharmacists, such as residencies, much like medical residencies, and then fellowships where you can work on research and go into like industry jobs like GlaxoSmithKline or somewhere else. So that's sort of a little bit about the education. I know when I started pharmacy school, I didn't know much about other paths. I was working at Car Drug as a technician, and so I thought I would just go into retail. But as you go through pharmacy school, you learn that there's a lot of opportunities in the hospital, like where I work now at WakeMed, and of course UNC and some of our other community hospitals have a lot of pharmacists that are really called clinical pharmacists, and I'll speak a little bit more about that. Of course, there's retail, which is sort of the backbone of pharmacy still in the community, and then the industry jobs where a lot of friends that I know that weren't really interested in retail or hospital love to work on projects and work on protocol writing or medical writing or just being involved in early research and development, have gone and done fellowships where then you can get a job in industry. So and you're also able to do, when I was in pharmacy school, I was able to do some summer internships to get a taste of that, to see what I was, if I was interested in that too. So that was a great opportunity as well. These are just some older statistics. I haven't updated them from the 2018 Board of Pharmacy. 17,000 pharmacists licensed in the state, and you can kind of see the breakdown. Still a heavy focus on chain or retail pharmacies. Again, that's still so very important as our community pharmacies. But you can see that it's broadened out into some other opportunities as well. There's even pharmacists that work in nursing homes, making sure those patients have safe medications, charitable clinics, as well as teaching and other things like that. So there are a lot more opportunities than you may realize, before you start in school to learn about that. So a little bit about what a pharmacist day looks like. Obviously, if you're more familiar, you've walked into your CVS or your Walgreens, your pharmacist there is reviewing your prescription for accuracy, checking the prescription to make sure there's not any interactions between your drugs or between other supplements or foods that you're taking. They are able to give education to you right there at the counter if you have questions. A lot of people don't realize this too, that the pharmacist can also call your doctor if they're concerned about things and review things with your doctor to make sure you're on the right medications and therapies. So that's, in retail. And then, of course, they're putting the pills in the bottles and getting them labeled correctly and ringing you out at the register. So industry pharmacy, a little bit different. I mentioned a little bit about this research, working on protocols, and then ensuring the safety and quality of drugs as they go through the development phases. So pharmacists work in several different departments in industry. They can be in clinical science, drug development, medical affairs, regulatory affairs, and then pharmacovigilance, which is sort of the after a drug has been approved, making sure there's ongoing safety studies just to make sure there's nothing that wasn't caught in the early development stages. So these are the types of jobs that I don't know as much about because that's not what I do, but I do know a lot about hospital pharmacy. I've been working at WakeMed since the day I graduated from pharmacy school in 2009. So I've really enjoyed working in hospital pharmacy. I was fortunate enough to have a job here at WakeMed when I graduated. A lot of pharmacists now do residencies in hospitals to receive additional training, and I can answer questions about that as well. But just in general, hospital pharmacy, a lot of people don't realize when you're in the hospital, how do you receive your medications? When you're in the community or at your house, you pick them up from the pharmacy. But what if you're in the hospital? How does the patient get the medication? So that's what pharmacy in the hospital is, from a basic standpoint about. The pharmacists are in charge of reviewing the orders that the doctors or other providers put in for safety. They make sure the dose is correct. They make sure it's the right dose for the patient's weight. They look at interactions with other medications, and they look at the patient's allergies to make sure that we're not giving a patient something that they're allergic to. The orders are usually entered into the patient's electronic medical chart. We at WakeMed use a system called Epic, which a lot of other area hospitals use, which interfaces with, your medical chart. They can send prescriptions to the pharmacy, and then that information is there for anyone taking care of you to see. So the medications also get entered into your medical record. And then I'll show you some pictures in a minute. They can then be available quickly to the nurse in what's called a Pyxis station or an automated dispensing cabinet, or we can send them directly from the pharmacy. And pharmacy technicians play an incredibly important part in preparing and delivering medications to the nurses. So here you can see a picture of the, sorry, it's hard to follow along because I'm not in control of the slides. So the medications can come out of a Pyxis station, which you see there. That type of device can have medications as well as supplies. There's several different types of these, but we use what's called a Pyxis. And then, of course, if the medication is not in the Pyxis, it's something that the pharmacy has to prepare. So you can see some pictures of sterile compounding. We have a very large sterile compounding area at WakeMed where we're preparing IV medications. And of course, a lot of those can't be in the Pyxis stations because we have to prepare them specific for the patient and bring them up. So a lot of folks ask, is math needed for your job? A lot of times when you're in school, learning certain skills, you think I'll never use this, but math is important. We use math to prepare the medications in a very simple stage, but also we use math as a pharmacist to make sure the drugs that are being prescribed to you are doing the right things in your body, such as vancomycin. We have to take blood levels and make sure the levels in your bloodstream aren't too high and going to cause adverse drug events. So that's just a simple example there, but math is something that you do end up using when you're in pharmacy school. A lot of folks ask, how do we remember all the drugs? There are so very many drugs. I know in pharmacy school, they usually have you remember the top 300 or the top 100 just of those very common drugs. But right now, that's very hard. We do use handheld devices to look things up quickly, use the computer. That's what's nice about the electronic medical record. It has links to the medications so that the nurses can look them up, the pharmacists can look them up. So a lot of that information can be right at your fingertips, but it is important to know and have, some of the basic medications in your brain. So a lot of some questions from previous presentations were, are the work hours fairly normal or do they vary? I will say this, if you're going into healthcare in general, you need to expect to work various hours. It's not a bank. We don't open at 9 and close at 5. We're open 24/7. So for me, I work fairly normal hours, but I can take phone calls and come in on the weekends. A lot of our staff work sort of traditional hospital shifts, which are first shift is 7 to 3:30, second shift can be 2:30 to 11, and then a lot of times for third shift staff, they'll work a 7 p.m. to 7 a.m. shift to cover the whole night. We have a group of pharmacists and technicians that work what we call a 7 on, 7 off, where they do 12 or 10-hour shifts for 7 days and then they have 7 days off. And a lot of folks really like that because it gives you a chance to spend time with your family or do other things or even work another job. So the hours are a little different than, what some other folks might be doing. Is it easy to find a pharmacy job? I think if you have a pharmacy degree and you're willing to be flexible, North Carolina, it might be, especially Raleigh, North Carolina, it could be challenging. But if you're willing to travel, I mean, there's always opportunities available in other areas. COVID has impacted our entire world, but here at work, a double whammy for anyone in healthcare is that it's affected your personal life as well as your work life. This has been one of the more challenging years for me professionally ever. I've been working super long hours. We've had to change our entire operation to make sure that we're taking care of ourselves and our patients safely. And worrying about things like shortages of personal protective equipment, gloves, medical supplies, drugs, all of that. And then trying to learn all the new therapies that are coming out for COVID to make sure that we're dispensing them to patients appropriately. Another thing that we have now is the vaccine, where it's great, and we've had a lot of opportunity to give vaccine here at WakeMed to our employees as well as the community, but that's been a lot of work. Have I always wanted to be a pharmacist? For me, I knew that I wanted to do something in healthcare, so I took the opportunity in undergrad to take all of the science and other courses that I needed to be able to apply to any type of healthcare program. And then I did take a few years off and I worked in a hospital as a nursing assistant so that then I could take the opportunity to figure out, did I want to do nursing, pharmacy, medical school? And so that was really a great opportunity for me. Ultimately, pharmacy has been a perfect fit for me because I'm able to get a taste of a little bit of everything. And now that I'm in hospital sort of pharmacy administration, I'm also working on my master's in business administration to get, additional skills for that job. So for me, it's been an excellent choice. As far as pros and cons, pros there, it is job stability. I think pharmacists will always be necessary, and pharmacy in general is growing in terms of clinical pharmacy. We have pharmacists that round on the teams with the doctors, and the doctors really like having pharmacists as part of that team. So I do think that there's a lot of growth and stability. The pay is pretty good, so that's helpful when you're making decisions. You also have an opportunity to help people and to work as a team with others here in the hospital. We have a lot of interdisciplinary teams where we work with nursing, we work with respiratory therapy. So it's really something new every day, and the day goes by quickly. And there's also leadership opportunities, which I wasn't really aware of in pharmacy school, but now that I'm in the position I am now, I love that I have a chance to learn and grow as a manager, still doing pharmacy, which I enjoy as well. Some things to consider, though, hospitals and many retail pharmacies are open 24/7. So again, being prepared to work non-traditional hours, which some people love, but for some people it's tough when you're trying to balance family and other things. It's not really a work from home job, which has been tough with COVID. I know when the world shut down, a lot of my neighbors were working from home. My husband's working from home, but I still had to show up to work each and every day. And of course, there's stress. So as much as it's exciting and new, there's always something going on, and it can be stressful. So finding ways to stay mentally and physically healthy is important. So what attributes does someone need to have to be successful? Some of those things are listed there, but really just, I think a desire to help people and then also work with others to, work in an environment that is really focused on others and focused on taking care of people. And really, it's incredibly rewarding if that's something that you want to do. But these are some characteristics that will certainly help. So I went through that pretty quickly, but I'd love to take questions or hear from you all if you have anything that you want to ask.
So there's a question in the chat. Do you have to have an undergraduate degree before applying to pharmacy school?
No. So a lot of pharmacy schools accept, I think they do require that you have the first 2 years of your undergraduate degree. And then some people are able to enter and begin their pharmacy in their junior year.
And there's another one here. How long have you been in the workforce?
So like I said, I graduated. Actually, my original degree was in public health nutrition, and I at that time realized I wasn't quite ready to go into graduate school. So I worked in a hospital for a number of years, and then I went back to pharmacy school at UNC Chapel Hill for 4 years. Graduated in 2009, and then I've been working at WakeMed since then. So what is that? 11 years, and it's been great.
Cool. Are there any other questions right now for Erin?
If anyone wants to send questions in or email them, I'd be happy to get back with anyone and answer those questions as well.
And here is another question. What types of skills or personality traits are needed for being a pharmacist?
So some of these that I have here, like I said, a really important thing is to be focused on working as a team. I mean, I could not do this job by myself. It's so important that I can work with my colleagues and figure out what everyone's strengths are and work together. And I do think it is important to be ready to work. This isn't a job. I know for me, I have a desk, but I'm rarely at my desk. It's running around and making sure patients have medications. So really, being able to work in a fast-paced, kind of stressful environment is important as well.
Yeah. What is the hardest part about your job?
I think, sometimes it's that every day can be a little bit different. There's always something that comes up that maybe I have never heard of before. Medication is requested by a doctor that I'm not aware of, and I have to go learn about it and make decisions on the fly. So I think, that can be difficult, but at the same time, it helps the job continue to be rewarding and stimulating. So, I mean, overall, it's, pros and cons, but I think I prefer working in an environment where, there's something new that comes up every day. But it can be challenging if I'm not sure of the answer. But luckily, we have a teamwork environment. There's always somebody I can ask for advice and work with them to come up with an answer.
I can imagine that would definitely be challenging. Hannah from the chat wants to know what the average salary is.
I think right now it's a bit variable, depending on, where you go. And, I think it's definitely dependent on the demand. I know that in Raleigh, for example, the demand might not be as high, but I think, anywhere from 80 to 120 would be reasonable.
Do you have to do regular continuing education?
Yes. So you are required by the Board of Pharmacy to do CE every year. Luckily, it's a combination. You have to do some live hours. I think it's about, they change it frequently, but I think 8 hours right now. And then some can just be online doing, online activities through like Power Pack and some of the CE things. But luckily, if you can go to one of the conferences, they have NCAP, which is a local conference, and you can usually get your continuing education by doing those things. So there's plenty of opportunity to do it. It's usually not very challenging to get it done.
And Jasmine wants to know if you would recommend this job.
I mean, I would. I think healthcare in general is a wonderful opportunity. I think for me, the reason it works is, I enjoyed when I was a nursing assistant, but it was a little bit more of a physical hands-on with the patient, which, some people love that. In pharmacy, it's a little bit different. You don't have quite as much hands-on direct patient care, but you're still in the hospital and part of the team. And if you like math and science, but you're not quite sure you want to be in a direct patient care role, then it's an excellent opportunity. If you are looking to have more interaction with patients, like being at the bedside, then, I would think that nursing or some other field like that would be better. But you kind of have to, learn about all of those opportunities and make that decision.
Mm-hmm. Here's another question. With the way technology and science is constantly changing, how easy is it to keep up with the new medications and vaccines?
Ooh. I mean, it's hard, but luckily you do have the computer. I mean, I have to Google things sometimes. These vaccines that have been coming out fast and furious, luckily the information is readily available. Sometimes you just have to sit down and take some time. Like, we just received the new Johnson & Johnson vaccine, and I haven't had quite the opportunity to sit and read about it. But I mean, you do have to keep up. You just have to kind of figure out which things are a priority. And right now with the vaccines, I am very focused on learning as much as I can about those so that I can answer questions.
Mm-hmm.
But the information's there. It's just finding time to digest it.
Right. I had a question. I know you mentioned Raleigh is not super demanding right now for pharmacists. Where are some areas that are?
Yeah, so I think there's a lot of opportunities for pharmacy in rural areas or coastal areas. I've been reading a lot about areas that don't have as many pharmacies, especially right now as we're trying to get vaccine out to folks that need it. So I think just being open to, going where the jobs are, but I do think there's opportunity in, other areas that don't have like big cities.
Yeah.
So I know people in pharmacy school that went to Alaska and went to other places. So, I mean, just think of it as an opportunity to go somewhere different.
Yeah, that's awesome. Are there any other questions from the chat right now for Erin? Hannah says a student wants to know what are current issues in the field of pharmacy.
Well, right now, there's a huge focus on vaccines for COVID. But I think a lot of the issues are, trying to figure out where the pharmacist fits in on a team. We're constantly being, asked for more. And so, trying to figure out where we can fit in to round with doctors. But then there's also a huge focus on medication reconciliation. So making sure that we have resources. Right now, we have actually pharmacy technicians that do medication histories in our emergency department. And that's a big push to really get more resources, because it's so important for each patient to have the correct medication list when they come to the hospital, so that we can continue their correct medications and then continue them when they go home as well. So those are big issues. They really call that transitions of care. So we're really focusing right now on making sure that we transition people into the hospital and then out of the hospital back into the community with the right medications, so that they don't end up back in the hospital because they're not on the right medications. So that, to me, is a really big focus right now. We've been working very hard on that this year with a lot of our pharmacy teams and the nursing groups to make sure that we have the medication list exactly right when folks are here.
Any last questions for Erin? Another student wants to know what you enjoy most about your job.
I love my job. I mean, WakeMed in general is an awesome place to work. I really enjoy working with others and working in a community hospital that has a focus on not only the patients here, but keeping the rest of our community healthy. So I just feel fortunate to get to come and work with people that are my coworkers, but I also consider them friends. And we have a lot of fun. Like the pharmacy department, we like to, put on music, and we're getting some cookie cakes later this week to celebrate the years of service awards. We've had folks that have been here for 35 years. They've worked in the pharmacy department. So, I mean, that goes to show that, WakeMed and the pharmacy is a great place to work. So we're going to celebrate that. And we all have a good time here at work.
Very cool. Aaliyah wants to know why you chose your career as a pharmacist.
Well, like I said, when I graduated, I had done nutrition, and no offense to nutritionists, because we have an awesome team of nutritionists here, but I sort of wasn't sure what I wanted to do. So I worked in a hospital. I went to Durham Tech one summer and got my nursing technician certification so that I could work in a hospital and really see what everyone was doing. So that was a really awesome experience to be able to see. And then I was able to work with nurses, physician's assistants, doctors, pharmacist. And then, talking to my friends who were pharmacists, it just seemed like that would be the best fit. So I just was lucky to have that hands-on experience and then apply to pharmacy school and get in. So.
A student wants to know, what does a typical day of the week look like?
Well, like I said, we usually get here at 7 o'clock. First shift starts, and we have a huge. I think part of this was going to be a virtual tour, which maybe we could do that. Because it is a little bit easier to show what we do. I mean, we have a huge batch of medications that has to go out each morning, patient-specific medications, fill the Pyxis machines. The phone is constantly ringing, so you're constantly taking phone calls. The pharmacist, we have 2 pharmacists down in the central pharmacy that are checking medications to go up to the floors. Our pharmacists that are called decentralized pharmacists sit out on the nursing unit, and they are there to verify orders, talk to the nurses. They go and counsel the patients about their medications. So really everyone's day is a little bit different. But a typical day does involve getting medications to the patients, answering phone calls. The pharmacists on the floor also are a consult service, so they can be asked to dose medications and then follow the patients that are on those medications. Some of the pharmacists also attend rounds. They go on rounds, which is truly what it sounds like. They walk around and go to the patient's bedside, talk about the patients, answer questions. So a pharmacist is on that team. So each pharmacist does a little bit of something different when they're here, but I could go on and on and on, but it is something different every day, and each pharmacist, depending on their assignment that day, might do something a little bit different.
Right. How many days a week do you typically work?
So for me, in a management position, I do work a traditional sort of 5 days a week. I do take phone calls and other things on the weekends. But most of our pharmacists do work most like a 40-hour week. Unless they're part-time, then they would maybe only work 20 hours a week.
Okay. I think that's it for questions right now. I'll toss it to Jen. If she has anything.
And like I said, if anyone has any questions, feel free to send them to me and I can, continue to answer them.
Okay, so I think that Jen isn't hearing us or has muted herself. So Kevin, it looks like you're on here now. Do you want to just go right into your presentation?
Robin, that'd be fine with me.
Great, thank you.
Yeah, you're welcome. All right, so hey everybody, my name is Kevin Parrish. I'm the manager here in the Medical Simulation Center at WakeMed in Raleigh. With me here is Dr. Graham Snyder. He's our medical director. He's also an emergency room physician, as well as a professor at UNC School of Emergency Medicine. And we're going to talk about some medical simulation that we do here in the center at WakeMed. So we're going to talk about, obviously, how simulation relates to healthcare. We'll talk about how we deliver that education to the folks that come down here for simulation. What kind of mannequins that we use to deliver the education. We'll talk about different ways to use the mannequins. Some of them are high fidelity, some of them are not so much high fidelity. They're just kind of tools that we use that lay static. And we'll talk about ways to use moulage. So we'll create cuts and bruises and holes in places that we shouldn't have them, and how the folks can get a little bit more out of it if we make it a more realistic environment, and how we can bring that education to those folks so that they can learn something from us and bring it to the patients that they treat on a daily basis. So here's the definition of what simulation is given by the Society for Simulation in Healthcare, one of the organizations that promotes simulation internationally. It's a technique that creates a situation or environment that allows a person to experience a representation of a real event for the purpose of practice, learning, evaluation, testing, or to gain understanding of systems or human actions. And then we have a quote that was published in 2001 in a publication on simulation. Simulation is a method whereby an artificial or hypothetical experience is created that engages the learner in an activity that reflects real life conditions but without the risk-taking consequences of an actual situation. So we try to put people in an environment where they can practice stuff and it's safe and they can make mistakes so that they don't make mistakes when they see that real patient out in the care areas. So we're going to talk about who uses simulation, where simulation came from. Initially, simulation kind of started off with aviation, and you'll see in the next couple slides where it started off not only in aviation, but with the military. On that top left-hand corner, you see the blue box is what they called it. It's kind of a manual representation of simulation for pilots to give them a feeling of what they would be feeling in an actual airplane. It was kind of very rudimentary, low tech, but the best that they could do at the time. And then the top right hand side, you'll see the aircraft that landed on the Hudson. That was Sully Sullenberg. And he accredits his training in a simulator to his safe landing on the Hudson, which saved every passenger's life on that terrible day. But so I'm sure many of you out there have done some sort of simulation in a gaming environment. You can see on the bottom right hand side you have flight simulator controls that one might have in the house, and you find on the screen where you put your game up, your Xbox or your PS5, whatever it is. That's also considered simulation. So not that it trains us to go out and fly an airplane, but it gives us the experience in the seat of our own house of what simulation does. And these are some of the things that we use in medicine, not necessarily the joysticks and all, but to give you the realism. So again, military uses it. You see the rudimentary cavalry, how they trained back in the day compared to what we're doing now. So you'll see the soldiers on the bottom slide using virtual simulation or virtual reality, put them in a room where they put their goggles on and they're seeing things in their goggles that they need to respond to. Anything to add to that, Dr. Snyder?
When I think about simulation, I think about how, like, and for all these things, horseback riding in the top left, and military operation on the right and left. I think like that kind of education, it's not that book studying is not important. It is, but it, in a way, it can only get you so far. Like if the only instructions that we gave a soldier was shoot the bad guys and don't get shot, or if you told a person to ride a horse by say get on the horse and ride fast and don't fall off, that doesn't really help you at all. And medicine's kind of the same way. Like if I'm a trauma surgeon, I'm taking care of a patient who's smashed up in a car crash. I could teach them in a book. Make an incision, open the person, find the blood vessels, tie knots around it, and then close the person back up. But you can learn that in 10 seconds, whereas it's only in the training, it's the only when you practice it, when you do it in real life, that you learn the hard parts about it, and also develop the skills to bring to a real situation.
All right, so moving on to the next slide. There we go. So again, early adopters of medical simulation are the EMS agencies, not only paramedics and EMTs, but also firefighters and police officers. These folks, you can see, have a mock-up in a room of the back of an ambulance so that they can practice on simulators, the mannequins, what they would do for real patients in their real environment. So we often try to create the environment that the people would be working in their real life situation. We have here in our center mock-ups of patient rooms, whether it be an ICU or a general floor bed, to put the participants in an area that would be more familiar to them in their work environment. So the learning becomes better. It's more familiar to them, so that when they go and see their patients up in the either the ER or the ICU, they've done it before. So it's their brain is telling them, "Hey, I've done this before, and it's not the first time I'm doing it." But to Dr. Snyder's point, you don't want the first time somebody's doing, say, an emergency procedure on a patient to be on an actual real human being. We want to do it down here in the simulation center. So, yep, next slide. There you go. And here's where the mock-up of the real patient room is. And this is in an academic center, like a nursing school or some kind of maybe a respiratory therapy school. They do lots of simulation at the academic centers. And one of the things that some of the schools have an independent simulation center for each program that they have. So, for instance, Viadin has a simulation center for just their medical school. So all the physicians that go through med school there go to that sim center. The nursing school has their own simulation center. So all the nurses go through that sim center. And their allied health, like respiratory therapy, will sometimes have their own sim center. Sometimes those sim centers talk to each other and they collaborate on delivering education, and sometimes they don't. But in the end, it's not the first time these folks are doing the procedure when they see their first patients. Anything to add?
Well, I was thinking so when I learned to start an IV, the way I learned was I practiced on my classmates, which, I mean, it's okay, but we weren't really very good at it. And so, it hurt a lot and it was scary and it was awkward. And now, before a nurse puts an IV in the first time, they've practiced, 10 times, 20 times, 100 times on a simulator and gotten used to it so that it's just not so weird and clumsy the first time. And, when it's me, like an IV is pretty harmless, but there are some procedures in medicine which have a lot more risk. And so it's great to be able to practice it on a robot before doing it on a human. Next slide.
Great. So the next slide is going to be the hospital-based simulation center. And this is a picture of our actual sim space. So the guy in the foreground here, he's going to be the operator for this simulation. And then the two folks in the background are the educators for the simulation. But one of the benefits that we have here at the hospital is that we do a lot of multidisciplinary. So I talked about those siloed programs that are academic based. So the School of Medicine, the School of Nursing, the School of Allied Health. We combine all of those professions into one simulation. So it's a lot of fun in that respect. And then you can get into, the idea that simulation is not just for a certain discipline, but it's for every discipline. And we want all of our folks to experience simulation, even before they get into the profession, as well as continue that learning throughout their careers. So, well, next slide, please. Again, here we have the different academic centers that might have their own independent solutions to simulation. And then we can have a multidisciplinary approach to it, or an interdisciplinary approach to it as well. And here's where simulation becomes fun. So the high fidelity simulation are the mannequins that can do all sorts of things. They have pulses and they breathe and they have noises. You can hear breath sounds and heart tones and bowel sounds, and some of them sweat. It's pretty exciting to see the response from the people doing the simulations because they think a lot of times that the simulators aren't really anything but more than a dummy that sits there and does nothing. But they can actually get vital signs from those high fidelity simulators, and we use those quite frequently. And it's fun to program them and run the scenarios, surprising the participants many times to get them to an endpoint. I know Aaron had talked a little bit about the COVID-19 and how it has affected what we do. One of the things that we have developed over the last year is COVID-19 related scenarios so that our providers here can better respond to patients who are suffering from COVID-19 virus here in our hospital. Dr. Snyder has been big on developing those scenarios and delivering that education.
Yeah, that's so a lot of times we talk about, like, in simulation we talk about risks to the patient. You know, you don't want to blow an IV, give someone a big bruise, or or something more significant. But what COVID-19 introduced to us is something that we don't think about that much, and that's, what if taking care of this patient could end up hurting me? And especially when for COVID first hit, um, we're pretty scared and nervous, before we knew exactly how dangerous it was. And so we spent a lot of time simulating COVID-19 patients with the robots, who the robot would not be able to breathe, the robot would be scared, the robot would have unstable vital signs. You would have to resuscitate the robot, but you would also have to make sure that your maneuvers didn't put you in a position where you would get mucus or even breath that had COVID-19 in, and inoculate yourself. And if you did it wrong, well, then that's okay. We would sit down and talk to you about, okay, so next time you do it this way so you don't catch COVID-19. But it's just a drill, so nobody gets hurt.
So some of the other things that we do are low fidelity task trainers. And those are just, say, basically somebody wants to practice putting an IV in. We have IV arms with vessels in them, because you don't really need a whole mannequin to do that type of training. So we have just kind of an arm with vessels that are filled with blood, so that the provider doing the learning gets that kind of a feel for how to place that IV. An important skill, obviously, but they're not doing that practice on Dr. Snyder. So sort of some other things are computer games, like I mentioned before, and lots of you folks have done those at home. That's a form of simulation, though maybe you're not going to do that in actual practice, but maybe in the future you'll go to medical school and work next to Dr. Snyder. We do sometimes use actors as well, and that's great for when we have scenarios that provide that patient feedback to the providers who are practicing. We had a case to use some actors here recently, and it worked out so well. They were able to get the education to the providers better than if we had used some type of even high fidelity simulator. So next slide, please. And so planning is one of the biggest parts of what we do. Dr. Snyder is going to tell you he plans to probably 4 times more time putting in the planning than it does actually delivering the education. You want to talk to that?
Yeah. So the one of the hardest things about doing simulation is you have to meet like a minimum quality so that it doesn't feel fake. Like if you're like, oh, I'm just standing around, I'm pretending to do medicine with a pretend robot, then you don't really learn as much. And so you have to take the time to program the robot to react like a real person would, and even make sure you have things in the room, syringes and drugs, and sometimes we'll put like photographs or video on the wall if you're doing like you're resuscitating a patient who's pulled out of a fire. Then we might have like a burning building in the background. And so even though that's subconscious, it adds to the reality of the situation and makes the quality of the experience better. And the reality is it's stressful. We push our providers pretty hard. There's curse words every once in a while. There's a tear or two, because it's a stressful challenge being an emergency physician or a trauma surgeon, and we want them to have those stressful situations in a place here where it's safe, where you can get worked up, but then learn how to manage those emotions and manage your decision making in a way that's learning, and not in a way that could result in a bad outcome. Next slide.
So here we try, like we've tried to talk about earlier, we try to make this as real as possible. So one of the key phrases that we throw around here in the center is suspend disbelief. So what we try to do is make the folks believe that they're in a real environment, they're taking care of a real patient and doing real things to save a life or to make somebody's day better. We also want to make it a safe environment for our participants, the people who are coming down here for education, both physically and emotionally. So, to Dr. Snyder's point, sometimes we'll see some range of emotion from the participants, whether it's anger or fear or sadness. We have to try to protect them from getting too much of that. So that's something in the planning of the simulation that we take into account was what are we trying to evoke out of these people, and when do we know we're going too far? And we try to draw back from that and make it a learning environment, not so much an emotional environment. And we also want to, when the scenario is finished and everything's said and done, and we're going into the classroom to talk about what just happened, we allow folks to reflect back on what happened. We talk about what the condition of the patient was, what type of interventions were done to help that patient get better. But we want to do it with deliberate action. So we want them to be mindful that this is not something that they should take lightly, right? So they put a lot of thought into their actions and their statements. And that just kind of gives them that it solidifies what they have learned in the past. It also gives an opportunity for them to learn new things. We give them put them in that learning environment in their brain. So, anything to say on that? So, next slide, please. As you saw in some of the pictures before, we use lots of props. So I mentioned that we try to make things in their environment look like they were in their real workplace. And oftentimes we actually do go to their real workplace. But when we can't do that and we're down here in the Sim Center, we go to pretty lengthy degrees to get some of the props in so that they can use those. And that some of them may be as small as a phone so they can dial a phone. And we'll have somebody on the other end of the phone act as a doctor or a family member, so that it can add that type of realism and have that conversation with the doctor to say, here's what's going on, what would you like us to do, and then carry on with the simulation that way. We also have, now we're attached to the hospital, but we're separate in that we don't have any patient care areas down here, but we do have real oxygen that we use. We have pressurized medical air that we use. We have a call bell system that we use. So it gives those participants that haptic memory so that when they're doing it down here, that's what they're going to do most likely in a real patient care setting. Go ahead, next slide, please. One of the other fun things that we do when we are trying to train folks to react in certain situations is drill things like mass casualty events or tornadoes, hurricanes, any type of natural disaster you could think of, or man-made disaster for that matter. But things that we do to help train these folks, to help put them in that real environment, is to add things like you see in the background. There's a TV screen that's showing firefighters putting out a fire in that house. So imagine there's several patients here that have smoke inhalation and possibly burns. So there's sounds that are going on here. There's sirens going on here. You can hear the water coming out of the hoses to fight the fire, the crackling of the fire in the background. Lots of different things going on here to add that realism, to add that little bit of a stress level for these folks. Anything to say about that?
Well, just, the more reality you can inject, the better. And one of the reasons for that is because it's often not the pure academic knowledge that is the hard part. You may know all about treating smoke inhalation injuries, and may know about carbon dioxide and carbon monoxide, but it's hard to think when there are sirens and crackling smoke and people are interrupting you, and that's why that's why in real life things are much harder than than when you're reading about them in a book or hearing about them after the fact. And so we do that. We do that to add the distraction and the challenges, so that they will learn not only the basic knowledge, but how to apply that knowledge when things are difficult.
Cool. So we'll go through the next couple of slides pretty quickly. I know we're coming to the end of our time here, and I want to get to some questions too. So I talked in the beginning about moulage to make things realistic, and here are a couple of ways that we can do it. We can simply write a note with some words on it and say, here's your code blue call button, so that you press that button when you need an emergency response from around the hospital. And we have fake wounds, we have fake lines. Go ahead, next slide, please. And here's a central line, so we can use this line in one of our settings so that we actually give medications through the lines. We're not faking it. If the nurse says that she's going to give a bolus of normal saline of 500 milligrams or 500 mLs, they can actually do that. We have IV pumps, and we can pump that fluid through. We don't want them to tell us they're doing it. We want them to actually do it. And here's another one it's a hypothermia catheter. We do some targeted temperature management stuff where we would control the patient's temperature so that they don't get overheated in certain circumstances. So go ahead, next slide. And here's a nice one. This was fun. This was a full-on surgical procedure where the patient's chest was cracked open, and they were responding to a leaky heart. So go ahead, next slide, please. And like I said, we sometimes will go up to the patient's unit or to the units in the hospital to do simulation. On that bottom left-hand side, we even did simulation in the helicopter in the air while it was flying. Over on the right-hand side, we practiced an evacuation drill where we put someone in a sled so that we could slide them down the stairs. So we did horizontal evacuation for a fire it was a fake fire, but it was a drill that we did so that people could learn how to do that. Go ahead, next slide, please. And so this is pretty much education at WakeMed. We get the focus, we get the objectives from talking with folks out on the units in the hospital, and then we create a scenario based around what they need. We also do testing of processes. So if the hospital is rolling out a new service line, let's say we're going to treat pediatrics in a different part of the hospital that we haven't done that before, we can create a scenario that practices that so we can tease out some of the obstacles that might present before we have real patients. So go ahead, next slide, please. So what's the future of simulation? What do you think, Dr. Snyder?
There's going to be more of it, and it's going to get better and better. We've already experienced the kind of strange phenomenon of a student coming in, working with a robot, and then encountering a real patient and doing the procedure fairly effortlessly. They're skipping the role of the novice because they gain so much experience working with the robots. As the reality of our simulations increase, I imagine we'll not only be able to educate people faster and easier, but also in environments where they never could have gotten education before. There are just not that many people that know how to do heart surgery, so it's impossible to teach that, countries and countries away. But now, if it's simply a matter of emailing a file, they upload it, put on their VR headset, they could be learning medicine just like you'd be learning at Harvard, but you could be, in the middle of Algeria.
Cool. And so entry points to medical simulation. As you can see, we have a physician. I started in my career as a respiratory therapist, and I got my nursing degree about 5 years ago. There are many different points of entry. You can be a simulation operator. You can go to Wake Tech, and they have an associate degree program for simulation operators. And I think to be a simulation educator, you really have to come through some type of medical career with some experience prior to getting into education. Because as the educator for simulation, you really have to be attuned to anatomy and physiology, patient treatment methodologies, and things like that. But there are many different entry points to simulation. And I think that's here are two of the national organizations that support medical simulation in the United States and internationally. And that's it. I have a few minutes for questions.
All right. Let's see. If anyone, we have a few minutes for a couple of questions if anybody wants to pop any in the chat. I'm not seeing any yet. If you do come up with a question, you can reach out to your teacher and we can get an answer to you. Here's a question. Can you be a little more specific about the types of careers that are associated with how a simulation center is run?
Oh, wow. In any really, and I don't think I'm exaggerating here, in any career in medicine now, you're going to be, if you're going to medical school or nursing school or pharmacy school or respiratory therapist school, or you're going to be doing simulation as part of your training. It's almost unethical not to. Would you rather learn on a robot or would you rather learn on a human being? Let's learn on a robot. So that's the obvious one, as well as any field that involves a physical, technical combination of skills. So, of course, if you're in the military, you're going to do war games. You're going to, in the simplest method, you'd be running around with a paintball gun, early on. But then there's tank simulators, helicopter simulators, and even, large battlefield simulators. Obviously, the first, aeronautics, if you're going to fly a plane, they don't just put you in a plane and say go. You're going to learn on a flight simulator. I think we're probably 5 years out from driver's ed being having simulation in that, and I suspect actually in some parts of the nation they probably already are. I think they should be doing it right now. You could teach so much with a real car simulator. Not not quite a video game, but there's just a lot to learn from there. So it's basically any technical field where you have to do stuff, we're going to be using simulation now.
Mm-hmm. All right. Well, thank you guys. Thank you, Aaron and Jen as well. We appreciate you guys taking the time to talk to us today. It was super informative.
Hey, thanks for having us.
Thanks for having us. Appreciate it.
Yeah, y'all have a good one.